Hello, this is an FNA of an enlarged cervical lymph node in a 33-year-old lady, and this is an example of Kikuchi-Fujimoto disease. This is the air-dried, hemacolor stained smear, and on low magnification we can see that majority of the cells are dispersed lymphoid cells. However, there are some larger, more cohesive appearing tissue fragments. The lymphoid cells appear to be quite mixed, and we can see small, medium-sized, and larger lymphoid cells. In some areas, we can see that small lymphocytes predominate. However, in other areas, medium-sized to larger lymphocytes appear to be more prevalent than small lymphocytes. Let's have a look at the tissue fragments. This is one of the tissue fragments, and looking at the periphery, we can still appreciate that this tissue fragment is composed of small lymphocytes, and they appear similar to the lymphocytes in the background. Therefore, we are not dealing with metastatic carcinoma, we are dealing with a lymphoid cell population and hence a lymphoid pathology. Again, in some of these areas, it does appear that medium-sized lymphocytes predominate over small lymphocytes. Looking at this area, we start to appreciate that there are some interesting looking cells here, for example this one, with an eccentric, somewhat compressed nucleus and some chirorectic debris in the cytoplasm. A couple of other cells here show a similar appearance. And yet again, in this particular cell has an eccentric nucleus that is actually crescent-shaped. These are known as crescentic histiocytes, and they are a very classical feature of Kikuchi lymphadenitis. And here is a particularly classical example of a crescentic histiocyte with the crescent-shaped eccentric nucleus and chirorectic debris in the cytoplasm. You will also notice that we do not see significant numbers of neutrophils in the background, and we also don't see frank necrosis, even though there is a lot of this chirorectic debris within the histiocytes. And here is a high magnification view from another case of crescentic histiocytes. And we also see here this example of a plasmacytoid dendritic cell, which has been described in Kikuchi disease. This cell can be quite difficult to pick up, and this is often positive for CD123. Here is the alcohol fixed smear from the same case, and again we can see these dispersed lymphocytes, and in the alcohol fixed smear, the appearance is somewhat more reassuring because it appears that there are predominant small lymphocytes admixed with medium-sized and larger lymphoid cells. And in this area, we can see very striking crescentic histiocytes with lots of chirorectic debris within the cytoplasm. Here is another case showing many crescentic histiocytes, and in this case, the cells are even more prominent. Kikuchi disease is also known as histiocytic necrotizing lymphadenitis, and very similar cytologic features can be seen in autoimmune disease, for example in SLE, hence clinical correlation is very important. And this condition tends to occur in young adults in the cervical lymph nodes. Originally, this was described as being more common in Asia. However, it has been described around the world. The patients may present with painful lymphadenopathy, fever, sometimes night sweats, or even weight loss, and this is a self-limiting condition. Let's take a very quick look at the histology, and we can see here that this particular lymph node incisional biopsy shows this pink area of necrosis. Sometimes the necrotic material can actually spill over into the perinodal fatty tissue, as we can see here. And there is abundant chirorectic material from necrotic cells. And right at the edge of the necrotic area, we are able to see the crescentic histiocytes, the same cells that we saw on cytology, and you can see all the chirorectic material within these histiocytes. In summary, this is an example of Kikuchi-Fujimoto disease or Kikuchi disease, and this is also known as histiocytic necrotizing lymphadenitis. We have a mixed lymphoid population, sometimes with a higher proportion of larger lymphocytes, so this is a potential pitfall and differential diagnosis of lymphoma. But the key feature is the presence of many of these crescentic histiocytes, and sometimes also frank necrosis, coupled with the absence of acute inflammatory cells. This is a self-limiting condition. I would also like to invite you to check out our free pathology online resource, Pathweb, and this houses, among other things, a virtual pathology museum with more than 1,000 fully interactive annotated virtual pathology specimens, as well as hundreds of talking pots and talking slides videos. The registration link is in the video description, and registration is free of charge. Thank you.